Thank you very much. Good morning, distinguished panelists on the dais and esteemed participants. It's very interesting that we have been talking about tobacco prevention, banning, everything. Everybody has mentioned that it has to involve people. We have been always saying that I have been always highlighting we have to understand the felt needs and the health needs of the people. If their felt need is, I should be having tobacco, you can't help. Whatever health needs you perceive from your side. Tobacco consumption, what we are seeing, I should not be quoted on that, but if you go to any field level primary health school, if you ask the teacher and ask the experience of the teacher, he will say that Maku and Tambaku are in part and parcel of a 10 years old boy. He would be having Maku in his pocket. That is there. That's a fact of life. And from there, how it comes, because the BD and the pawn shop which they are having, he provides the BD patta free of charge to that small boy because he can't afford to purchase the tobacco. That kind of problem which we are dealing. That means the societal value, though it has deteriorated, it is only driven by greed. He is having his own marketing strategy. The moment if I edit that person, the person would be, after a while, he would be purchasing that tobacco from him. Initially, if you go to any shop, even in Delhi also, ask for a BD patta, you will get free of cost. Because he knows that after chewing the BD patta, he will come back to you, and after some time, he will be going into some other form of that kind of prevalence is there. Though we have tried to regulate it, because if you talk about regulation in India, if you are educated enough, lawyers are there here, if you are educated enough, you cite anything and you are having a law for that. But regulating, do we have the capacity to regulate? No, it has to be a people's movement. That's why there has been focus on Jan Andolan. We do have COPTA, which talks about the regulation, the trade and the practices, but it don't talk about the banning of tobacco. And there's a debate going on whether tobacco it is a food product or not. That in front of the honorable court, some petitions are there, and a decision would be taken. If it is a food, then the FSAI Act would get into this and they can ban it. Otherwise, whatever they are doing it under the purview of that, that's one thing. Apart from that, the cause and effect things which we have been talking, it takes time because the longitudinal study which we have always been referring about this cancer, smoking leads to cancer, cancer of lung. So we have to, and it's a time-taking thing, and people will never appreciate that because they will say that since the age of 8-9 years I've been chewing tobacco, I've been consuming it, and you see that it's not a single episode. It's the episode starts from that way, and they want to 9 years, 10 years. Then he will, because the nicotine level, it is having an addictive value, addictive effect into the body. Because as the age progresses, you require more and more stronger nicotine to get the same kind of kick. And as a result, the person ventures into other modalities. As madam, you have rightly pointed out, if you see the number of the infertility clinics, because if you look at the trend which the gynecologists they are having, your contention, your observation, it holds true. Because lot of infertility clinics are coming because the smoking is one of the causative factor for that. After 4 or 5 years of practice, most of the obs and gynae, they are venturing into infertility clinic because they know that this problem is there. The second question which we have to ask, because regulations and other things, that debate and discussion will go on. Do we have enough cancer hospitals to take care of these people? No. Even if we make a cancer hospital, the rate at which the consumption of tobacco and other things are going on is very difficult. The only methods which we can do is preventing it, that too, through the school education. We do have a school health education program, but if you go to any school, not to talk about the urban area, the urban people, they would be having vaping and other things, but at the rural area, they are having tobacco, they are chewing tobacco. It's a rampant practice in the rural areas. Not to talk about that. Very sorry to say that what we are doing for the future of the country. We talk about the demographic dividend. If you talk about the BMI of the population, if you might have encountered the younger working population, how much effort, how much work they can do without tobacco and other things. You see how the economic impact of the, one of the things which we have to do is to have a behavioral nudge kind of units everywhere. We have a structure in the National Tobacco Control Program. At the national level, we are having a tobacco unit. State level also we are having, district level also we are having. But where is the behavioral nudge? We have to nudge the cigarette smoking is injurious to health. But what? Where is the behavioral nudge to, who are the people who can nudge these people to have a protective practice? The second important thing, harm reduction, another thing is very difficult because as the addiction is very chronic, he requires an equal amount of nicotine. And if you are giving nicotine in any form, in any way, that is not harm reduction. You are doing more harm to the person than doing good for that person. Because you become so much dependent on the nicotine for your even your day-to-day life, and he will be seeking more and more this. And as a result, if you do a study about the substance abuse and the nicotine, you will find that the person has been trying nicotine for long. Now he want to have a more higher kick and other thing. As a result, he will land into substance abuse. So we are taking that thing. Another aspect which is coming and which is related to smoking is the mental health. We have been talking about mental health, but we don't accept that it's a part and parcel of this. With the regulation, we have to see that how we address all this challenge, one, the mental health, the infertility, whether we are ready for dealing with the cancer patients or not. So it's very easy, philanthropic to have a cancer hospital, but it's very difficult to have a preventive program for cancer. Though with the efforts of the awareness, the banning and other thing, you now have no smoking rooms. People will say that I'm going out and smoking. That kind of secondary smoking is not there, but still a lot of work is required to be done. Regulation, would be there. Banning will result into some illegal activities and people will smoke because they are so much dependent on that nicotine level for a long time. If they are into college, they are already 10 years into the tobacco chewing habits. And after that, they will be seeking for more and more. That's why you see, it's not only tobacco chewing, it is leading to substance abuse and other things. We have to be very careful and guarded in that when we are making policies and banning things. Banning is not the answer. We have to find ways. Though there is a petition in the petition committee of the parliament, they are trying to see that whether we can have a ban on the tobacco or not. But we have to find out a way. Still, there is debate going on whether it is food or not. Still, debate goes on whether with that act we can ban this tobacco or not. And the second act is about the regulation, whether having an advertisement will result in reduction in the smoking or not. The narrative needs to be changed that we don't have, it causes cancer, do we have adequate facilities for treating this patient? So, ठीक है, आप करते रहिए, but do we have adequate facility for treating this patient? This is leading to infertility. Now you see the cost of the infertility which the urban people are having. The cost of moving from the tobacco abuse to the substance abuse, you have to find out, because there the harm reduction, usually substitutes are being used and they are quite effective. Instead of having an addictive thing, in the substance abuse you can have a harm reduction thing, but here in nicotine, if you think that it would be harm reduction, as a medical doctor I don't think, because it is having an addictive value. In the clinics, when an old person comes to us saying that they are chewing tobacco for the last 50 years, we never ask them to stop tobacco because we know that whole of his system is dependent on tobacco. Unless that particular nicotine level is there, his system will not work. And reducing that thing is a very, very humongous task, and it's quite, in fact, not possible if the person is addicted for a long time. The future proofing of tobacco regulation, we can do that, but it's very, very difficult proposition. We do have 2 acts. Lot of discussions are going on. We are adding on how to prevent, how to reduce the advertisements and other things. But once the things goes into your subconscious, it's very difficult to take it out from then and nudge the person to change his behavior. Thank you very much for this opportunity. Thank you very much.